Dr. Sindher, thank you so much for joining us.
Thank you so much for having me.
So what is it about wildfire smoke that specifically impacts dementia as opposed to other kinds of air pollution? Why wildfire smoke?
That is such a great question. Part of it may be that wildfire smoke, it's not just, air pollution from cars and vehicles, but really it is burning rubber and buildings and factories and chemicals. There's so many things that are contributing to wildfire smoke when we breathe in the PM 2.5 particles. And that all of that, once it's inside your body and, causes inflammation, is likely contributing to worsening cognitive impacts.
Yeah, because you think of dementia as being a brain issue and then breathing in wildfire smoke as being a respiratory issue, right?
Right, right. So the wildfire um, particulate matter, or PM 2.5, is about 3% the diameter of the human hair. So these are tiny, tiny particles that when you breathe it in, it is going deep into your lungs, into the alveoli where the blood and the air exchanges. So that's where these toxic materials are actually being exposed to your blood vessels and becoming part of it's being spread all over. And we suspect it's causing inflammation, not just in your blood vessels, but where that blood is coming into contact with different parts of your body. And that likely is contributing to the inflammation in the brain, leading to worsening cognitive decline and dementia.
Now, this is all coming out at a time when millions are under an air quality advisory because of the wildfires that are happening all across
That's
our state, especially here in Northern California. So, what are people supposed to do to protect themselves?
Oh my gosh. So a lot of what we do with immunology and allergy is prevention, prevention, prevention. So as much as, all these efforts are underway to, y- you know, um, to control fires as they happen, but what we can do as humans, once we have been exposed to the wildfire, is try our best to reduce our exposure to the poor air quality, the air. So this can be through wearing a 95 mask, staying indoors whenever possible, limiting outdoor exposure, especially vigorous exercise or anything that will increase your respiratory rate, which is not always feasible. It's, someone who works outdoors, it's really hard to say, don't go outside, but really just knowledge of, how to minimize the exposures can really go a long way. Also, it's a reminder to reduce activities inside our homes that may be worsening air pollution within our homes. So burning candles, gas stoves, all of these things have an additive effect. So wherever we can control for it, we can try.
I'm thinking of all the kids also who have camp
That's
outdoors this
right.
time of year. I mean, should we be concerned about our kids and their potential risk of dementia later on in life?
Oh, that's a great question. I hadn't thought about that element of it because most of these studies looking at dementia have been done in adults over 50 years of age. But in children, what we worry about is more respiratory contributions of wildfire smoke, and of course, just long-term inflammation and what kind of impact they may have. And because children are smaller, they actually breathe in more of the polluted air per their body surface area and their ratio. So it is that much more important to reduce their exposure. But you're absolutely right. In the summer, where it may not be feasible to have air conditioning in all schools, and it's hard to keep children inside and be safe. It's so helpful to have air quality meters, perhaps, so you can assess what the air quality looks like inside and outside, and that may help determine a lot of the activities that are done with children. But yes, with poor air quality outside, highly recommend keeping kids inside as much as possible.
Yeah, yeah. I mean, this news is so alarming to so many of us because if you live in California, chances are you are exposed to some kind of wildfire smoke, whether or not you live near a wildfire-prone area or if you're just in the direct vicinity of it with changing wind patterns, etc. But is there a silver lining to this in that doctors are getting better at determining what actually causes dementia? I mean, is there a silver lining to this news in that the advancements are being made?
So I would say whenever we can identify some of the triggers behind some of these chronic conditions that we don't have a cure for, I think that's where we can look at uh, mechanisms of how we can address it, maybe how we can impact it early on and take on prevention strategies so that we reduce these down the line. So absolutely, wherever we have more and more information on what may be triggering different chronic conditions, it just gives us more opportunities to help support patients and their families earlier on.
All right, Dr. Sindher, thank you so much for being with us today.
Thank you so much. Thank you.